Like every other profession within the healthcare system, the number of nurses in Nigeria seems to be dwindling. At the Lagos State University Teaching Hospital, about 5 nurses resign daily. But LASUTH's Chief Medical Director, Professor Adetokunbo Fabamwo, says the hospital's nursing workforce has already reduced by 35%. And he talked about the shortage of nurses at the scientific conference of the Retired Nurse Administrators Healthcare Initiative. Sarah Ayeku reports.
Known as the 21st century angels, nurses make up the largest proportion of the health workforce. Nigeria has in the last 1 year experienced a mass exodus of nurses. According to the Nursing and Midwifery Council of Nigeria, about 7,000 of these nurses migrate annually to Europe, North America, and the Middle East. Here in Lagos, 3 to 5 nurses resign almost every day at the Lagos State University Teaching Hospital due to Nigeria's poor economic condition. The hospital management is engaging retired nurses on contract basis because it is difficult to get qualified and experienced hands that will maintain the standard of healthcare delivery.
Every day when I sit on my table, I sign about 3 to 5 resignation letters from nurses. The nursing workforce in our hospital has reduced by about 35%.
I wish to challenge this group to be an eye of the government in monitoring of our health facilities to ensure compliance of younger colleagues to ethical issues in clinical service, to reduce the burden of litigations being levied on the sector due to clinical negligence of all health workers and negative attitude to work.
A lot about our nurses in the healthcare system. We have seen that you have taken note of that, and the health reforms have taken place in that area. Your top position is superb, and I will encourage you to continue with that.
Retired but not tired. That's the spirit behind the Retired Nurses Administrators Healthcare Initiative, a non-governmental organization using their meager pension to provide sustainable humanitarian healthcare services for residents and healthcare providers in Lagos. Despite retirement, many of them are still used as resource persons during hospital unit conferences, seminars, and workshops. The retired nurses in Lagos are asking the government to implement the reviewed retirement age of nurses to 65 years.
Global challenges that people are having around, I will just employ our nurses to bear it a lot with the government, while the government also to look into the ways of putting spice into the faces of the nurses so that we can retain them.
The word for nurses still in service is innovate and align with the changes resulting from climate change and strains of diseases. Sarah Ayeku, TVC News, Lagos.